Good day, everyone. For today's topic, me and my group mates will be tackling about the introduction to chemotherapy and antibacterial agents. But first, what is chemotherapy? Chemotherapy is actually referred to as the therapy of diseases, may it be infectious or malignant, through the use of chemicals, also known as chemotherapeutic agents. These systemic infections have different causes that can range from bacteria, viruses, fungi, protozoa, helminths, and more. A key feature of chemotherapy is that it does have a minimal effect on the host since it applies the property of selective toxicity where it only targets the pathogen involved. The basis for this selectivity depends on the variation of structural components and the metabolic processes between the host cell and the pathogen. This selectivity in most of the antibiotic exhibits a certain degree that includes number 1, inhibition of cell wall formation. Examples are penicillin and cephalosporins. Number 2, inhibition of bacterial protein synthesis. Number 3, bacteriostatic effects of sulfonamides due to PABA antagonism and folic acid. This is where chemotherapy comes in. There are vast differences to other drugs since it is designed to inhibit or kill the infecting organisms without significantly affecting the host. To fully dive into the topic, let me first present you what does antibiotic means. Antibiotic is derived from the word antibiosis, which means opposite to symbiosis. These are substances that includes microorganisms such as fungi, actinomycetes, or bacteria that suppresses the growth and at some point may kill other organisms at very low concentrations. Today, both natural and synthetic are included in the category designed for the antibiotics under the chemotherapeutic agents. But here are the different classifications of antimicrobial agents. Number 1, based on chemical nature. Number 2, based on mechanism of action. Number 3, type of organisms against which primarily active. Number 4, based on spectrum of activity. Number 5, based on type of action. Number 6, based on the source. Under the chemical natures, we have diaminopyrimidines, which examples includes trimethoprim and promethamine, quinolones and fluoroquinolones like norfloxacin and ciprofloxacin, beta-lactam antibiotics like penicillin, cephalosporins, and carbapenems, aminoglycosides like neomycin and gentamicin. Further, we also have tetracyclines, macrolide antibiotics, polypeptide antibiotics like polymyxin B, colistin, and bacitracin, glycopeptides like vancomycin and tiglopenic, nitrofuran's derivatives, nitroimidazoles, nicotinic acid derivatives, Polyene antibiotics like nystatin and amphotericin B, azole derivatives, rifampin and lactic ketoconazole. In terms of their mechanism of action, there are some classes that are included. They range from inhibit cell wall synthesis, penicillin, cephalosporin, cycloserine, vancomycin, and bacitracin. Drugs that causes leakage from cell membranes that includes the polypeptides and the polyanes. Drugs that inhibit protein synthesis like tetracyclines, chloramphenicol, and erythromycins. Those that interfere with DNA functions like rifampin and metronidazole. Those that interfere with DNA synthesis. Those that are drugs that interfere with intermediary metabolism like sulfonamides, sulfones, PAS, and trimethoprim. And last are those that inhibit DNA gyrase like fluoroquinolones.
The other classification of antimicrobial agent is based on type of organism involved, which includes antibacterial. Antibacterial is used to stop bacteria from growing or killing them. And some of example of diseases in animals caused by bacteria are fall cholera and sheep pneumonia. The antimicrobial agent that used against on this type of organism are penicillin, aminoglycoside, tetracycline, and erythromycin. Next is antifungal. Antifungal is an antimycotic drug, a class of drugs used for the treatment and prevention of mycosis or systemic and superficial fungal infections such as histoplasmosis and blastomycosis. Some examples of antifungal agents are grisofolvin, amphotericin B, and ketoconazole. Antiviral. Antiviral drugs aid the body's defense against viruses. It can help to elevate symptoms and minimize the duration of a viral illness. Some of the antiviral agents include acyclovir, cidofudin, and cidofovir. Antiprotozoal. Antiprotozoal is any substance that kills or slows the development of protozoan organism. Malaria and Chagas disease are among the illnesses caused by protozoans. Some examples of antiprotozoal agents are includes tinidazole, pyrimethane, and metronidazole. Anthelmintic. Anthelmintic is a drug used to treat parasitic worm infections in animals. This comprises flukes, tapeworms, and roundworms. Some examples of anthelmintic agents is mebendazole and pyrentel. Other classification of antimicrobial agent is based on spectrum of activity. Spectrum of activity includes narrow spectrum and broad spectrum. Narrow spectrum is an activity that only able to kill or inhibit limited species of bacteria which either gram-positive or gram-negative organism. Example of this is streptomycin. While broad spectrum acts against a wide range of disease-causing bacteria when the suspected bacterial infection is unknown. It acts in both gram-positive and gram-negative bacteria. The example of broad-spectrum agent is tetracycline, chloramphenicol, and erythromycin. We have also, based on type of action, as classification of microbial agent. It includes bacteriostatic and bactericidal. Bacteriostatic is a chemical agent that prevents or stops the bacteria from reproducing. Usually, it is antagonistic to bactericidal agent. Example of bacteriostatic is sulfonamides and tetracycline. While bactericidal, it is a substance that kills bacteria by inhibiting the cell wall synthesis. The example of bactericidal is penicillin, aminoglycosides, and vancomycin. Antimicrobial agent is also classified based on the source or where the antibiotics obtained from. In fungi, example of it is cephalosporins, where it derived from the culture of the fungus Cephalosporium acremonium. The Penicillium notatum is also a fungus which is used to produce the antibiotic penicillin. In bacteria, we have polymyxin B and colistin, which is both obtained from the bacterium Bacillus polymyxa. The following are the principles of successful chemotherapy. First, it is an unselective toxicity in order not to affect the host cells. Also, chemotherapy should be rational and backed up by either clinical or microbiological diagnostic to identify harmful organisms. Also, it is a possess characterization of pathogen, including its sensitivity to an antimicrobial agent, is important. The selection of an appropriate drug is also important to have a successful chemotherapy. The drug should be used and taken at the right time by the right route and by the appropriate dose rate to ensure the effectiveness of the antimicrobial agent. Attainment of effective concentration of chemotherapeutic agent for a sufficient period at the site of infection is also important, and a specific and suitable supporting therapy should be used to get rid of the infection.